we began this journey of Ayurveda from the Vedic stage, where you saw the beginnings of Ayurveda, concepts, some practices. Then there is a long phase of Indian history when Buddhism was dominant in India, and how the practice of medicine had changed radically from the time of Vedas in the Buddhist period. There is a very big change in the practice of medicine, but how a thread of continuity remained during these many, many centuries. But we have very little by way of documents regarding the practice of medicine in the Buddhist period. We have to go by incidental references to medicine in Buddhist texts, which are essentially religious texts. So you wouldn't expect to find any details about a human body, about diseases, about treatment. You wouldn't expect that in a religious or text or a scripture of Buddhism. Nevertheless, we have been able to get a fair amount of interesting material. What we have today, the practice of medicine, essentially dates back to the 1st century, when Charaka is believed to have lived in North India, somewhere in the Kashmir, Punjab area. That is where his doctrines, his text is still an authoritative text, still used in Ayurvedic colleges, translated into all languages, translated into Persian. So it is an extensive coverage all over the world, Charaka Samhita. But Charaka says, I am only redacting a text called Agnivesha Tantra, which existed earlier, obviously during the Buddhist period. Many centuries it had been a popular text, but that is no longer available to us. It existed, there is no doubt, because Charaka Samhita, the most authoritative commentary, was written by Chakrapani in the 11th century. Without reading Chakrapani's Arogya Deepika, it is difficult to understand Charaka Samhita. And Chakrapani often says he is quoting from Agnivesha Tantra. He had access to that. So that text did exist, but we have no longer any information on that. Similarly, the Sushruta Samhita, the second most authoritative text, redaction was done by a Nagarjuna. We are not very sure of the identity of this Nagarjuna, whether he was the alchemist, whether he was the Madhyamika philosopher Nagarjuna, or was it a third Nagarjuna? We are not very sure. But that was in the 4th century, after Charaka redacted. Now he was redacting an earlier book of Sushruta. That is also not available. So we have a lot of difficulty understanding really the practice of medicine during those 1000 years of Buddhism. It is quite possible someday, if we have the luck, the National Manuscript Mission, they claim they have 5 million Indian manuscripts, 2 million have been catalogued, they have been put on the web, this is what I am told, and it is quite likely someday somebody will discover some of these texts in that vast collection. May not be in Sanskrit, it could be in a translation into some language like Orissa. I am surprised more than 200,000 manuscripts in Odia. You may find in one of these suddenly Agnivesha Tantra, which would give us a very different view about the practice of medicine during that particular almost 1000 years. So we start with the Charaka Samhita, 1st century, and then what Charaka wrote, subsequently all that has been redacted, written, somehow they can all be traced to Charaka Samhita. That is the foundational text of Ayurveda. So that is what we will be doing today from the 1st century, then the redaction of Sushruta Samhita in the 4th century, and 6th century, Vagpata, who was a native of Sindh, he wrote a very highly poetic, wonderful book called Ashtanga Hridaya. And he writes there, people have become so busy, they have no time to understand what Charaka and Sushruta wrote. This problem we face today also. Charaka and Sushruta, they are very businesslike, like a modern textbook of medicine. when they begin, they don't start with an invocation. They straight away start, we will discuss the science of long life. That's how they begin. Whereas Vagpata, he wrote a highly poetic version, neither too long nor too short. He cut out a whole lot of philosophy so that for the practicing doctor, for the students of Ayurveda, he made it a lot easier. That was in the 6th century. So this period is essentially what I would like to call systematization of Ayurveda, which has survived ever since. This is the whole point. In some way it is like we are going to explore a large area, a country. We have to have a field map to have some understanding of the places that we will be visiting, of the routes we will be taking, and so on. We have general idea. That's what I will be doing today. So much of many things which I say today, they will be repeated later on. Suppose we deal with a particular place in today's review, that place will be seen in detail later on. There is a certain amount of repetition, but that repetition is essential for good understanding. Now here the contents of this, as I already indicated, is 1st to the 6th centuries. That is the period that we will be covering today. And the main themes of this systematization of Ayurveda, one is health care and patient care. They are two different things. Health care is Swasthavritta, which is given preeminence in Ayurveda, and patient care, Adhuravritta, which is secondary. And this is incidentally very similar to Greek medicine, Western medicine. Aesculapius was the king, was the god. He had two daughters, Hygeia and Panacea. And Hygeia was the elder daughter, very much like healthcare, prevention, good nutrition, preventing disease. She was the elder daughter, Hygeia. And Panacea was the younger daughter. That is, when you are sick, if you got into trouble, then you have to have treatment. So by giving medication, that is Panacea. But over the course of centuries, Panacea has become dominant. Nobody wants to take hygiene today. You go to a medical college and ask option of medical students, you will hardly find anybody wanting to take hygiene. Community medicine is the least popular. Everybody wants internal medicine. This is a reversal. In some way here also in Ayurveda, you find Swasthavritta is the health care, how to protect your health, how to keep yourself out of trouble, and Adhuravritta is how to get out of trouble, which is much more difficult. These are the two areas, and Ayurveda gave priority to Swasthavritta. The second is the foundational doctrines, Panchabhuta, Dosha. We will deal with these later in greater detail. And the foundational doctrines, I call them like that because practice of medicine, there will be changes, the formulations that you give, the various other procedures that you do, the standard operating practice, all this will keep changing. It may change from one place to the other. What is done in Kerala may be different from what is being done in Bengal in Ayurveda procedures. But the foundational doctrines, they do not change. Only the superstructure will change. Like Panchabhuta, which we will be reviewing that, it doesn't change at all, it remains the same. Then food and drinks, which is almost as important as medications because this was one way they could intervene in the events in the body, how they could manipulate it. They use food and drinks almost as effectively as medications. So Pathya, that whole concept in Ayurveda, is food and drinks. A great deal of attention was paid to that. Then human body, structure and functions. There is nothing like we call anatomy. Immediately we think of the modern anatomy, skeletal system, muscle system, etc. That's not the way Ayurveda looked at it. So I have given, I did not want to use this one-to-one correlation, trying to use anatomy, physiology. That is not really the way in Ayurveda they looked at the body. So it is better to look at it body in health and body in disease. That's the way I have covered those subjects. Essentially they will deal with what we understand as anatomy, what we understand as physiology with all its limitations. Then we go to diseases, classification of diseases, causation, diagnosis, prognosis, all these were dealt with according to Ayurvedic understanding. Then treatment, once you have made a diagnosis you have to treat, and medical procedures are used and also formulations. Then treatment by surgical procedures, and lastly the training of physicians and surgeons. These are this pattern or this kind of an arrangement of medical subjects. This was all crystallized during these 6 centuries from Charaka to Vagpata, and they have remained more or less constant. If you go to Ayurveda being taught by an Ayurvedic physician in Maharashtra, go to Bengal, go to Benares, or go to Tamil Nadu or Kerala, you will find this basic pattern that remains. Lots of changes will be there when it comes to the procedures, the formulations that you use. All that there will be changes, but all these will be present in Ayurveda. This is what I mean by systematization that makes understanding much easier. Now these I already mentioned, Charaka, Sushruta and Vagpata, these are known as Brihatraye, the great 3 of Ayurveda. And 1500 to 500 BC and the early Buddhist period is, I have already mentioned that there are great limitations in the knowledge that we have about that period, and Agnivesha, Bhela, these are all authorities, we know they existed. Bhela Samhita, for example, Bhela was a contemporary of Agnivesha. There is a book named after him, but that is incomplete. There is a lot of controversy whether it is really Bhela Samhita. So we have great problem identifying any text which really existed at that time. So the knowledge is kind of incomplete, not very reliable. And Charaka's time is 1st century. We can be reasonably certain about what happened subsequently. Now when we come to the chronology of these 3, Charaka, Sushruta and Vagpata, Charaka is believed to have lived in the 1st century according to most authorities. There are also some who believe that he lived in the 2nd century BC. That is not as popular today. Most people tend to agree that he was a contemporary of Kanishka, the Kushana empire which was flourishing at that time. And there is a Chinese text, whether it was translated from Sanskrit we do not know. Sylvain Levy was the one who discovered this. There he talks about in that book, Kanishka, the great king. He was himself an extraordinary person. He was the great empire going on to almost up to Central Asia, the whole of North India, Afghanistan, etc. Now that great empire, which Kanishka was the king, and he was a Shaivite by faith. But there are a lot of difficulties in this because there are people who claim he was a Zoroastrian because he had coins issued in his time. And there are people who claim he was a Buddhist. So he was a person who encouraged all these faiths. And he had 2 companions with him. One was Ashughosha, the very great poet who wrote Buddha Charita, who was a Brahmin, converted to Buddhism, became an ardent devotee of Buddha and wrote this great classic Buddha Charita. And the other was Charaka, a physician. So they were the constant companions of King Kanishka. It's a very nice, sometimes when you read Charaka you will find the same thing, whether he was he a Buddhist or was he a Sanatani Brahmin, all these we are not very sure, we cannot make out because he was equally reverential, very much like Kanishka was. So that is about Charaka. And coming to Sushruta, that is even more controversial. Sushruta is associated with Benares, that everybody agrees. Benares was the Dhanvantari, the surgical school of Ayurveda was in Benares, there is no argument about it. But about the time Sushruta lived, the book that we have, Sushruta Samhita, was edited or redacted by alchemist or Buddhist philosopher, we are not very sure what he was, Nagarjuna, in the 4th century, that much is known because he himself writes there. But that original Sushruta Samhita or Sushruta Tantra, which existed much earlier, we are not very sure that Vrittha Sushruta, that is the term they use, the old Sushruta. We do not know his identity when he lived. But certainly there are some very interesting indications. Panini, who is the Ashtadhyayi, the great grammarian of India, Panini, almost everybody agrees he lived around 4th century BC, And in Panini's Ashtadhyayi, in giving illustrations, there are 3 references to Sushruta. Sushrutena proktam saushrutam. So he is giving an example, but obviously Sushruta's name was so well known in Panini's time, so he must have lived certainly before Panini. There are 3 references to that. That is very important. And the second thing is, in Sushruta book that we have, there is no reference to trephining of the skull. He describes a large number of operations, including plastic surgery of the nose and so on, but there is no reference to trephining of the skull. But Jivaka, who was Buddha's physician, and Jivaka's one of his great achievements was doing this trephining. In fact, in Benares, a merchant was severely afflicted with headache. There was no cure. He was given only 7 days to live by his physicians. And Jivaka was there at that time, and they approached him, and King Bimbisara's permission had to be obtained because he was the royal physician. So they got the permission of Bimbisara that this royal physician may attend on this merchant. He went and looked at him. He said he needs an operation. He did a trephining of the skull, and he is said to have removed 2 worms. This is what the Jataka description. Anyway, the whole point is that trephining of the skull, which was done by Jivaka in Buddha's time, that did not exist because Sushruta doesn't talk about it. So he must have been earlier. So Sushruta lived prior to Buddha. That would explain how Panini is referring to him, and that would also explain the point I made yesterday. Jivaka, a very brilliant young student living in Pataliputra, travelling all the way to Takshashila to study medicine. If Sushruta's school was flourishing in Benares, he wouldn't have gone all the way. All this would be explained. So it is very likely we are dealing with the Vritha Sushruta who lived prior to Panini. And Vagpata was a native of Sindh. He himself writes he was born in Sindh. The only controversy is whether there are 2 books, Ashtanga Hridaya, which is what I referred to, a wonderful poetry. I don't know whether he was a greater poet or a greater physician, whether he was the same person who wrote Ashtanga Sangraha. There are 2 books, both essentially dealing with the same subject. Ashtanga Hridaya acknowledges its debt to Ashtanga Sangraha, which is a bigger book. There is some controversy whether it was same person who wrote or whether it was father and son. That sort of thing, controversy continues. Maybe with computational linguistics, somebody takes interest in this. If they can have this present text and compare them, it might be possible that you might find 2 different styles. There were 2 different individuals. That sort of area where modern technology could probably help us in identifying the real, the Vagpata. Now the systematization which that crystallized during this 1st to 6th centuries, that has survived for 2000 years. All these years, this arrangement, the details may change, but that arrangement had withstood the test of time. And the main characteristics, which in the summary, in the initial contents I indicated this division into Swasthavrta and Ataravrta, emphasis on doctrines, foundational doctrines, classification of food and drinks, the human body, all this which I listed earlier, that is what systematization is, and that has stood the test of time, because India has gone through so many extraordinary changes during this period, but this has remained intact. And Charaka, among these 3, apart from all these which are really the nitty-gritty of medicine or Ayurveda, Charaka is the only person who goes into philosophy. It is almost a very, I use the word searchlight. Dark areas not well explained, he has a way of shining his mind and clarifying. In fact, Professor Dasgupta's History of Indian Philosophy, he says in 2 areas. One is Sankhya philosophy, we will touch on that later on. Charaka was one of the original contributors, because the original Mula Sankhya, it is very different from Ishvara Krishna's Sankhya, which we are all familiar with, 2nd century AD. You will find Charaka deals with Sankhya, evolution, parinama, very differently. And Dasgupta says this is the original Sankhya, Mula Sankhya, and that is a contribution of Charaka. He was a great philosopher. Similarly, the logical parameters of debate, how to conduct a debate. There is a whole lot of Nyaya Sutras according to Dasgupta. They have borrowed from this. So you will find that Charaka, apart from a great physician, a pioneer, he was also a great philosopher. He is the only one doing that. Neither Sushruta nor Vagpata go into philosophy the way Charaka does. And I will be discussing these serially, but each one of these will be discussed in detail later on. But there must be some initial familiarity before we go into these details. That is all I am trying to do today. Now, Swastha Vritta, it got much greater priority than the care of sick people, and health was not really freedom from disease. This is the modern WHO definition. This is very much in line with Ayurveda, and in living in harmony with the environment, harmony with all the living beings, and abjuring the extremes of non-use of our senses, overuse of our senses, misuse of our senses. This is a very important concept, because essentially that is sustainable consumption. When they talk about this use of senses, overuse, underuse, misuse, it is not only food, but all the resources which we have. If you have overuse, then that is not sustainable. So what we talk about sustainable consumption today, that is what the old terminology, the phraseology that they are using, that is very essential, because if we keep on consuming, wasting, we have realized now the dangers of it. The earth will run out of its resources. We simply cannot. So that is a very fundamental thing, and you cannot have Swastha Vritta if you have overconsumption or underconsumption in some areas. So that is one of the very basic principles. And then the code of conduct for maintaining good health, not only the daily life, oral care, bath, exercise, food habits, very great detail goes into sleep, sexual activity, even minute things like wearing nails, haircut, nothing is spared. All these are described, even using a walking stick, using a turban. They go into all these fine details about daily life. And beyond this, there were stipulations on social conduct. Like, for example, when you yawn, you should cover your mouth. You should not speak very loud in a company. Be modest. All that very great detail about social conduct. Temptations of wine. In fact, wine was enjoyed. You will find in Ayurveda the attitude is a very cheerful attitude. Food is not only to sustain your life, biological necessity, but also you should enjoy. That is the attitude of Ayurveda. But that is not the primary objective. So here you will find that temptations of wine, of gambling, all those, they point out how they should be avoided. And then above all, beyond bread, it goes into rectitude, sincere effort, indifference to result. This is what later on you have in Bhagavad Gita also, you have to work very hard, but don't worry too much about your result. This again you will find in Charaka, it's emphasized fearlessness, forgiveness, kinship to all forms of life. This is a theme which comes again and again. See yourself in others, in the ant, in the bees, everywhere. So that is another kinship with all life. And jubilation in success and depression in defeat, it should be replaced by equanimity. And this always reminds me, one of the greatest physicians in modern medicine was Sir William Osler. And many of us regard him as the father of modern medicine. Very great, inspiring teacher, physician. He was professor of medicine in 4 universities, Oxford, Johns Hopkins, University of Pennsylvania, McGill University, very great man. And when he was leaving University of Pennsylvania and going away to Oxford, he gave an address, and the title of that address is Equanimitas, that is a Latin word. And there again he points out this, Incidentally, I am not very sure how familiar Osler was with Indian medicine. He gave a series of lectures in Yale University about history of medicine, and there he hardly makes a reference to Indian medicine. There is a reference to Arab, China, but hardly anything about India. But I found that apparently on his bedside table there was a quotation from Kalidasa. So very interesting. I don't know how that came, but he talks about equanimitas, very much like what is said here. This exaltation when you get something and depression when you don't get it. That should be replaced by equanimity. Then we come to Atharvavritta. I am only touching on these different subjects. Here Atharvavritta was divided into 8 branches in Ayurveda. The first was Shalya, surgery. That was given the priority. And what kind of surgery did they do? There was no anesthesia at that time. So there were severe limitations. The knowledge of anatomy was limited. So the removal of foreign bodies was one of the commonest. Drainage of abscess, removal of dead fetus, setting of fractures, plastic reconstruction of the nose, ear and lips, removal of bladder stone, couching for cataract, use of surgical instruments, etc. All these we will be dealing with later on, but this gives an idea of the kind of surgery which was practiced at that time. And Shalakya, the head and neck surgery, was always considered separate from general surgery. This is head and eyes, ears, nose, like couching for cataract, for example. So all these were a separate area of medicine. Then Kaya Chikitsa is treatment of general diseases like fever, bleeding, tuberculosis, dropsy, epilepsy, all this, what we call internal medicine today. That was another branch. Bhuta Vidya, these are diseases, especially children and also older people, where the symptoms are unconventional, treatment is problematic, we don't really understand them, they are so unconventional, and many of them, the descriptions, they look like psychiatric illnesses, and they are possessed by some evil planet and so on. That was another branch. Then Kaumara Bhritya, what we call pediatrics, children's ailments, healthcare in children, breastfeeding, how to select a nurse, etc., all that goes into pediatrics. And Agada Tantra is toxicology, especially snake bites, insect bites, spider bites, all these were so common. Even yesterday I referred in Buddhist time also, they were very greatly concerned about snake bites, it was so common. Even today we have. So that was a separate area, treatment was different. Then we have Rasayana, procedures to promote pain-free aging, if I may use that term. Aging is inevitable, everybody will get old. But there is no need to have all kinds of infirmities with creaky joints, stiff joints, cataract, all kinds of disabilities. So Ayurveda believed that by timely intervention, rejuvenation, Rasayana therapy, it is possible to grow old without too many of these infirmities. Like Bertrand Russell, lived up to in his 90s, he had no particular illness and he just faded away. So that kind of, like a cells for example, if you grow cells, ideal conditions are provided, but will they go on? In fact, Alexis Carrel, many of you may have heard about him, a Nobel laureate, great surgeon, and he wrote the immortal book, Man the Unknown. And when he was in Rockefeller Institute in New York, he grew, cell culture was a great advance at that time, and he grew cells, and he claimed that if you provide ideal conditions, nutrition, temperature, etc., these cells will keep on growing. They are immortal. They are not cancer cells, they are normal cells. And he claimed that heart muscle cells he was growing. And throughout his life they were kept alive. And when he passed away, that Rockefeller Institute continued to keep this. Finally, somewhere in 1930s or 35, something like that, this was all destroyed. But now we know this is not correct. There has been even questions about Alexis Carrel's honesty has been questioned, whether he was making a false claim. But the charitable interpretation is whenever they are putting the fresh medium, some new cells might have been introduced accidentally. But what happens is a cell ideal conditions, it will keep on replicating, say liver cells or endothelium. But after a certain number of replications, maybe 30 or 50, they will automatically stop. A lifetime is primed into the genome. Now that is how normally the life should also end, not because of disease and suffering. And Vajikarana, the enhancement of erectile function, a very big problem at that time, and also fertility. They were in both linked, and Vajikarana was a, Vaji actually means a horse. To give a man the sexual potence of a horse, a 6-year-old horse. So that is Vajikarana, but it was always linked with fertility, especially a son. This was the major. Now these are the doctrines which, when we say foundational doctrines, I have given a few examples which do not change. And take for example one of the most fundamental, that is Panchabhuta. And Panchabhuta, these are space, akasha, air, fire, water, earth. These are the 5 elements which constitute Panchabhuta. And the Panchabhuta doctrine says all the universe that you see, they are composed of these 5 elements. So is the human body. So whatever happens in this to the 5 elements in the universe, they are bound to have a reflection in the 5 elements which constitute our body. So this has some medical implications, because I will be dealing with it later on, so I won't go into the details. But if substances in the body derived from these 5 elements, what we call dhatus, blood, muscle, bone, etc., if due to some abnormal conditions there is an increase in one of these or a decrease in one of these, then how do you manipulate it? How do you bring it back to the normal range? Then you have got to give that substitute the same substance of the same class. And if you want to decrease it, you have to give a substance with opposing properties. Now this is possible, and these are food or drugs, etc. These are external substances which are composed of these 5 elements. So unless this homology is there, you cannot just manipulate inside, increase or decrease these constituents of the body. So there is a, Panchabhuta is a doctrine, but it has its own medical interpretation or use. We will come to that in detail later on. So therefore something like the human body, since we so faithfully reflect what is happening in nature, you can even regard the human body as a cosmic resonator. That is the way this. The next is the 3 doshas, Vata, Pitta, Kapha. It has been extensively misunderstood. We will talk about it in some detail, because that is fundamental in Ayurveda. But essentially these are substances, they are not concepts. I have heard even Ayurvedic scholars, sometimes they talk about concepts. They are not concepts, because Charaka specifically says they are dravyas, they are substances, they are real. Now what are these substances? These are products of digestion, food that we eat. Similarly the substrates in all our tissues, the dhatus, there is constant activity going on. Fires are burning, just like the stomach, Jataragni is burning food. Similarly in all these tissues there are agnis burning, according to Ayurveda, burning substances or substrates. Now that also produces waste products, just like the food which is digested, one part becomes part of the body, assimilated, rest of it is thrown away as malas. Similarly in all these dhatus also there are malas which are produced during the burning, and all these malas in Ayurveda, they have a very important role. They are not toxic necessarily. So as long as they remain within that prescribed range, then they are essential for the body. They are called maladhatus actually, but once they cross that range, they become excess. Then they are doshas. So these Vata, Pitta, Kapha, these are actually 3 doshas. They are part of this mala category, but if they are in normal range, they are healthy, they are necessary for our health. It is something like saying, I do not like to use these analogies too much, but say cholesterol for example. There are many people who believe cholesterol is a great toxic thing, a poison, which is completely incorrect. It is a normal body metabolite that is necessary for cell membrane stabilization. But if it goes beyond range, it is a very different story. It is something like that here also. In Ayurveda, these Vata, Pitta, Kapha, they are essential, they are part of that Mala category, but if they cross their boundaries, then they become toxic. They damage the cells or tissues. That is a very basic concept. It comes up again and again. We will go into it in detail later on. Then we have taste, rasa, another very foundational doctrine, whether it is Charaka, Sushruta, Vagpata, everywhere you will find taste, rasa. And this term came at a time when there was no chemistry. Chemistry was not known. And rasa, taste, was used as a term to indicate chemistry. It is a shorthand for chemistry. So there are 6 primary tastes, secondary taste, etc. Now that was an indication for, as far as pharmacology is concerned, when you eat food, for example, that food is eaten and then it gets digested in the stomach, and then if you belch it, there is a different taste at that time because the chemistry has changed, post-digestive taste. Now that taste, the next is, you find here rasa, virya, there is potency, which is also different. All substances, they do not have the same potency. Potency is what brings about action. Some things when you take, you vomit. When you give a drug, an emetic, you vomit. That activity to bring about vomiting, that is potency. And substances have different potencies. So that is the third factor. And lastly, prabhava, which are, there are unknown factors. All these 3, taste, post-digestive taste, potency, they cannot explain all activities of substances that we take. Now that is prabhava. So these 4 characteristics relating to substances, they are the cornerstones of Ayurvedic pharmacology. That is another very important foundational doctrine. These hardly any change throughout these centuries. But there are others also like prajnaparatha, nothing to do with any of this. That is a behavior pattern where we know something to be wrong, but we persist in doing it. For example, alcohol. Everybody knows constant intake of alcohol, you will have cirrhosis of the liver, can be fatal, but still people will keep on doing. Smoking. Everyone knows if you keep on smoking, you can have oral cancer, you can have lung cancer, you get coronary artery disease. This is well established. Enormous literature on that. You see examples all around you. But does it stop people? They will still keep doing. This is, Charaka would say, is prajnaparatha, what we call lifestyle diseases now. It was called in those days an important category of diseases, prajnaparatha. That is intellectual error and malpractice or misconduct, whatever you like to call it, knowingly persisting in what is harmful to you. Now that prajnaparatha, that is another important doctrine. Then we come to food and drinks, very important. In fact, one of the longest chapters, both in Charaka as well as Sushruta, Charaka especially, he goes into very great length. And because the food and drinks are responsible, without that you cannot have any health, because body is constantly depleting, and to replenish what is being lost you need constant input of food and drinks. So great importance was given. But at the same time, if the food had incompatible things in it, or if it was polluted or inadequate, etc., it could also give rise to diseases. So it was both a source of health and also a source of ill health. So great importance was attached to that. And different type of classifications, plant, animal sources based on taste. It could be based on the type of eatable, drinkable, etc., that kind of classification. Physical properties, it's heavy or light. Heavy means it is not easily digested. That is another classification. Whether it is wholesome, unwholesome, so many different types of classifications of food. And Charaka for designing diets for patients, that was important because diet, pathya, was an important part of treatment, as important as formulations. So each patient had to have a particular diet designed for him, depending on the kind of illness he had, his strength, the season and so on. Now this was Charaka classified them into 10 different groups with many subgroups like grains, pulses. We will discuss this at great length later on, but it also shows the enormous knowledge they had about, they go into the type of how do you grow this rice, what kind of soil do you, what kind of, where do you get it from, what kind of manure that you are using. All these go into very great detail about the cultivation of these food items, collection, animals, different types of animals, which part of the animal is heavy, which part of the animal is light, into such a very fine detail about food and drinks. Now here, harvesting of food items, cooking, processing, preserving and all other aspects of food consumption, including a code for dining, that is also there. And food antagonisms, there is a whole table which I will be showing later on, how certain items cannot be combined with others. In fact, they are even supposed to have fatal results sometimes. All those are described, food antagonisms. And food safety. In fact, when the kings used to go on conquests, they always had their physician with him. And the physician's tent was next to the king's. He had always access to the king. And one of his jobs was, he was a supervisor of the royal kitchen on these campaigns. Campaigns would take several months. And he had to check the food, the raw materials coming from the market, cooking, getting it tasted, giving it to animals, giving it to other dogs, crows, etc. So getting it tested, that was his job, to ensure that the food was safe. So food safety, and suppose food poisoning happened, how do you treat it? So therefore there is especially Vagpata gives a long detailed description of the duties of a royal physician, how to supervise the kitchen. So a physician in those days, he was not only a physician, he was also a nutritionist, he was a culinary expert. All these jobs he had to do. That's how the food and drinks, they take a very large part of Ayurveda. Then we come to human body, parts and organs. This was recognized, the importance of anatomy, and Sushruta described, he said that dissection is the only way you can understand human body, but at that time the taboos attached to dead body were such, it looks like that touching a dead body would defile a person, leave aside cutting it with a knife. So what the practice, which was strange practice, was a dead body would be put inside a wooden cage. It's not completely airtight, some water could get in, and this would be kept in a shallow water body, in a stream for example, in a dark area so that people don't see it. It was to be done almost like in secrecy. It was kept in a dark place, and for almost a week it is left there to rot. At that point you take sharp leaves like darbha, there are with sharp edges, because you don't use a knife. And with this you have to scrape off layer by layer. This is how dead body was dissected. It's only 2 or 3 paragraphs, but you can well imagine this kind of dissection is highly imperfect. You really cannot understand human anatomy because the muscles, they would all have rotted. You cannot get a proper appreciation of muscles, number of muscles, their relationships. Only the hard parts, bones, cartilages, teeth, only those you could have a reasonable idea from this kind of dissection. That was part of our sociologic restrictions. I have no idea how it was, but that is how the dissection. And nobody subsequently, that is another great mystery, how in Europe it was a huge leap in medical advance when they started dissecting the body, because you get a complete picture. When you do surgery without anatomy, how do you do surgery? But nobody here, this particular very unsatisfactory way of doing a human body dissection, how over 1,000 years, thousands of years, nobody ever questioned it. This is a mystery to me, and we paid heavily for that kind of lapse on our part. Optimum measurements of body parts, legs, arms, etc., that was, in fact they are all given. the viscera, organs, their functions, they were all reasonably identified, the liver and the spleen, intestine. They are identified and also some reasonable idea about their function, but there were two exceptions, very important exceptions, where they knew the existence but the function was not understood. One is brain, Mastishka, it was known, described, but the function of the brain was not known. All that we, our emotions, our thoughts, reasoning ability, all these were attributed to the heart. They were located in the heart, not in the brain. This is a strange, the only Bhela alone with that imperfect Samhita which I mentioned, he is the only one among all these ancient authors who said the sensations, cognition, etc., it is between the hard palate and the top of the skull. That is the only reference we have. Otherwise all of them, Charaka, Sushruta, Vagpata, they all attribute these to cognitive functions to the heart. Another is lungs. Klomen, Pupusa, two terms are used, but the function of lungs was not known. Breathing, the movement of wind, compartmentalization of the wind, yesterday I referred to that. They knew there was a wind in the body, life breath, but life breath had many components, one remaining in the upper part of the body, one remaining in the lower part of the body, one moving things around, things are moving like blood is moving, so many things are moving in the body, within the body, and all these movements were, the motor was the wind, that is another type of wind. So different types of components of the wind, all this was known. Inspiration and expiration was known, but the lungs, that was not, function is not mentioned at all. So these are two, existence was known, but the functions were not known. And vital spots, these are marmas, Vedic mentioned marman, it is, so it was known for a long time. These are critical vital spots in the body where injury or a sickness or anything could be very dangerous. And they are classified, there are 107 marmas in the body, classified in many different ways, where muscles are dominant, where vessels are dominant, etc. And various types of, some are immediately fatal, which are correct. For example, an injury between the breasts, central part of the body, heart is there, a damage would be immediately fatal, which is understandable. They must have seen like a spear or a sword, some kind of injury, immediately fatal. But there are others, marman. There is a marman between the big and the second toe in the foot. Now it is very difficult for us to understand how that can be so very critical. But when you read the description, you find that this, after injury there, this patient, this man who was injured, he would develop violent convulsive movements and he would die. Obviously it is tetanus. So an injury there develops tetanus, after all they are walking barefoot, he could develop infection, tetanus, and he dies. So that is considered a marman, not in the same way an injury to the heart. So we have to interpret, some of them we cannot interpret. So but this concept was important for the surgeon, because when they make an incision, they have to stay away from these areas. That was the importance of this marman. And with the decline of surgery, which I referred to yesterday, all this marma concept, today's Ayurvedic physicians, they know there are marmas, but nobody actually pays any attention. But strangely, it found its way into martial arts. In Kerala, for example, Kalaripayattu, it is a big martial arts form. And there they pay a lot of attention to these vital spots. So it disappeared from the mainstream Ayurveda, found its way into martial arts. And the physiology, as we understand it, in Ayurveda, to my mind, digestion of food, we can really understand it in modern terms. We will be talking about it later on. But other systems, circulation, it is not really in the way we understand circulation, respiration, all these in modern terms, they had their own understanding. We should present it realistically, but at the same time try to have an understanding, how is it in today's terms, how do we understand it. So in terms of physiology, and I have already mentioned brain very little, and organ pathology, which is what we call pathophysiology, this is something I will be spending a little time on that, because if you have, for example, a child who is getting a sore throat, and some sore throats are dangerous because streptococcal infection, and that can later on lead after several months to attack on the heart. Now during that process something is happening in the body, because that what looked like an innocent throat infection, which could be easily neglected, nothing may be done, and later on this child becomes sick, there is a heart murmur, the valve is damaged and so on. Now during that process, from the onset of an initial trivial illness, you find that keeps on progressing, and ultimately the florid form of the disease appears. So during that, the disease process, the pathophysiology, involving the immune system, involving the cells, involving multiple organs. Now that whole process, there is no, that subject was not really recognized even in Western medicine. But in Ayurveda, how did they, after all they had seen the cause, they had treating the disease, what was their idea of the progress of this disease in the body when he had not come to you as a patient? Now that is something we have to pay some attention. I have tried to get, they were aware of this, but they are here and there, they are dealt with. So if you bring it all together, what was the Ayurvedic understanding of a disease process, pathophysiology, like this organ pathology, which is not mentioned as such anywhere, but they were aware of it. So this I will be discussing with it later on. Now Charaka's total body, the anatomy, 360 bones, and he conformed to the Athava Vedic total, 360, but Sushruta says, I do not agree with this Vedic total, it is only 300, but the actual is only 200. And the reason was many of these cartilages, teeth, all these were regarded as bones, hard tissues. So they came at this very high figure. Even prominence of certain, like rib, in the back of the rib there is a prominence of the rib, what we call a protuberance. Now that is also considered as a separate bone in Ayurveda. So they reached this total. And embryogenesis, that is a very great interest in Ayurveda, and they had their own ideas. There is a long debate in Charaka Samita, all the disciples having their own views about how the embryo forms, how the embryo grows, all the different time horizons of the development, how the mother during the 3rd month may have all these pica, the desire to eat raw fruits, sour things and so on, how that comes about, etc. Very interesting. So this was a subject, embryogenesis, of great interest in our Ayurveda. Not only Ayurveda, Ramayana has a very detailed description, so has Bhagavata. So it was a subject of universal interest in ancient India. Then we come to conduits in the body. They knew that blood had to move, air had to move, everything had to move. Even what we consider solids according to them were moving, like muscle. It was not a static thing. There is movement inside the muscle. How do these things move? And there were conduits, and there were dhamani, sira, srotas, these are all used. Nadi is also there. But it is very difficult to clearly say this is artery, this is vein, this is lymphatics. I have tried, many others have tried, and Brajendranath Seal, one of the great scholars of early 20th century, who had studied this subject, and he says finally at the end of this very difficult exercise, it is a standing puzzle. That is how he concludes. We cannot really, but these are all conduits, but that clear identification in terms of modern understanding of body channels, it is difficult to do that. And function of the vayu, respiration, these parts were recognized like prana, udana, this kind of division of air in the body, life breath, that was known. Prana, for example, was located in the head, chest, upper part of the body, and udana in the chest and throat. So somebody getting asthma, for example, it is udana's disturbance. That is how they would look upon that. That is how it would be treated. And the role of lungs was not recognized. Then the diseases, it's an encyclopedia of diseases. So many, if you look at them, so many great diseases. Many of them are still with us, some of them have disappeared, I tried, which I will be presenting later on, is it possible to have some idea about the kind of diseases which existed in Charaka's time 2000 years ago, what we call epidemiology. We know, for example, like coronary artery disease or kidney disease. We have a rough idea of how many people, 10,000 or per 100,000 population, how many people have coronary artery disease, 10%, 5%, whatever. That kind of information we have, that is epidemiology. And we can measure after 10 years what is happening. Is it possible to do something like that, what happened in 2000 years ago? And I have done an interesting exercise which I will be presenting later on. But what looks interesting, there is a disease which considered fatal in Charaka's time, we don't see it today. Many others which existed then, like tuberculosis, malaria, they are still with us, no change at all. Many of them dreaded in his time, like typhoid fever. They are not an object of terror at all, they are easily treated. So you get a very good idea about these diseases. And classification of diseases, again so many different diseases like location in the body, causation, prognosis in terms of curability, incurability, etc. So many different ways you can classify diseases. So Charaka in that regard, so many classifications, and if you go to different regions of India, you will find different ways of classification. Instead of doing this kind of multiple ways of classifying diseases, why not bring it to a common basis, disturbance of doshas, the 3 doshas. Without their disturbance, there can be no disease. So why not redefine diseases in terms of the disturbance of doshas? So Ayurvedic diagnosis is really not making a diagnosis of a disease conforming to international classification of diseases, giving it a label. That was not at all what Ayurvedic diagnosis is. That is to detect what is the dosha perturbation. That is what they are determining. So all these multiple terms that we use, they need not confuse us. This was Charaka's approach to diagnosis. Now then coming to causation, Didana, Hetu, these are all terms, Karana, these are all terms used to signify causation, and diseases can be caused by derangement of doshas in the body, or it could be exogenous factors, for example there extensive pollution which could produce some disease, or it could be psychological factors. All these could be causative of diseases, and they could also be seen as a consequence of overuse, misuse of sense objects. But the important point which Charaka makes, cause is fine, but cause alone is not sufficient to produce diseases, because causes exist within the body, causes exist all around us. You cannot sanitize the body or the environment, they will always be there. But in spite of all these causes being there, most of us are healthy. How is it possible if causes are existing without causing diseases? That is a very important subject in Ayurveda, because health is a state of equilibrium or samya. Now that samya is what protects us. Samya means, which we will discuss all this later, that samya is what protects us. Equilibrium of doshas, equilibrium of dhatus, equilibrium of the body with the environment, equilibrium of various fires burning in the body, Jadharagni, Agnis in the tissues. And then there is one called Hetu Samya. Hetu Samya is this: you have so many Hetus in the body, but they are not causing any disease. So there is a balance, a Samya state between the body and all these causes. If that equilibrium breaks due to some reason, then these causes begin to act. They may be sitting inside the body without causing any disease, but if that Samya breaks, then they immediately trigger disease. So that is a very important factor. Then we come to diagnosis, very dealt with in great detail, again looking for a particular disturbance of dosha samya. That is what disease is. And Kutumbaya, one of the great physicians of Vellore, in his book on Indian medicine, there he talks about it. He says the kind of diagnostic, the detail which is given by Charaka, it is the most comprehensive that he has ever seen, even much more than what he finds in Corpus Hippocraticum. And diagnostic process, there are 3 stages. One is a preliminary examination, that is, am I qualified? Am I competent to treat this disease? Nobody asks those questions now. Do I have all the equipment to treat him? Questions of that kind. That is important. The second is, once that is done, a preliminary assessment, the patient's dosha prakriti, things of that kind. That is the second. The balance between the patient's strength and the dosha, all these are preliminary assessments. One's own patient, physician's assessment, the patient's general assessment, and then we come to the third, what we do in an outpatient department today, your interrogation, inspection, palpation, all those examinations are done. But here, in that second phase of examination, there is a particular part which is called desha. I am just giving an example how much detail. And desha means the land, the location or the locale, that is what it means. But here Charaka uses desha in that second part of the diagnostic assessment. It is the place where this man is staying, the patient. And there you will find the kind of people who are living there, the kind of diseases they have there, what kind of food do they eat, what kind of medicinal plants grows there, all kinds of questions about that place. Now that is something interesting because a patient, where he comes from, details of that place. That reminded me, in modern medicine, all of you would have heard about Sir Arthur Conan Doyle, who wrote Sherlock Holmes. And Arthur Conan Doyle was a doctor. When he studied medicine in Edinburgh, he had a professor called Sir Joseph Bell. And this Joseph Bell was a remarkable man. In the outpatient department, and there was an old doctor from Kerala who was in Edinburgh at that time. And it is from his son that I have heard this story. When a patient would come in Scotland, very cold, a farmer would come. And Arthur Conan Doyle was a student, and this Joseph Bell was the professor. When a man would be coming, he would say, stop there. He wouldn't ask any question. But without asking a single question, he would say, this man is from Lanarkshire. He is a farmer. He is probably cultivating something. Like that, he will give a series of statements, then call that man and ask him. And 90% of whatever he said would be correct. Because what he was doing, little things, the kind of boots he was wearing, the clay sticking to the boots, some hay sticking there, the way he was wearing his cap with a tilt to one side, all those, which none of us would pay any attention to these little things, but they signify great things. A lot of it is understood, and this man would know, Joseph Bell would know, Lanarkshire, there certain diseases are more common in that area. So this Arthur Conan Doyle, a lot of his ability to infer things came from Joseph Bell. So when you read about Charaka asking these questions about this place where this man is coming from, today none of us would pay any attention. We don't even ask where he is coming from. So that diagnostic exercise is a very elaborate exercise. And what we do today in the outpatient, that is there, the third part, clinical history of the patient, assessment, etc. All the senses are used except taste, and taste is used like a diabetic patient. His urine, are there ants coming there? So taste is, in an indirect way it is used, otherwise all the others, touch sensation, smell, they are all used. And prognosis, the shape of things to come. Very important, a patient's most important question is, what will happen to me? That is what he will ask, the relations also, that is the most important question. And you have to have some idea about prognosis. And Charaka says, what are the first things you have to do, a physician, once you have gone through this diagnostic process, you have to decide whether the disease is curable. Is it curable with difficulty or is it incurable? You should decide before you start treating. That is one of the important, so you have to have some idea of prognosis. And that there are findings in the patient, for example, general wasting of a patient, general condition or severe pallor affecting the whole body. Then the disease itself, like tuberculosis, the man is coughing, his sputum coming, blood sputum, those are all diseases, but they localized more or less. and general appearance, anemia, pallor, wasting and so on. So, the general appearance, features relating to the disease, and lastly omens, various other prognostic signs. A lot of importance was given to this, but the importance of that is somewhat less. I will be presenting this later on, because the belief in the community even today, majority of people believe in many of these. And in Ayurveda they would never take the view, you are all idiots, you don't know anything. That Ayurveda never had. They always respected these, they don't necessarily accept, because I will show you a table later on. Charaka gives all these, some 70 types of observations. People believed in them. If a jackal is howling as you are taking the patient, many people believe that is an evil sign. Now, if you ridicule them, that doesn't help. It only creates more pressure on them. So, Ayurveda would never condemn any of these. So, in that, when Charaka gives a classification, many of them are actual physical signs about wasting or appearance of blue color, etc. he gives. But then there is another column where many of these are there. And interpreting these, the actual physical findings of severe pallor, sudden appearance of coldness, etc., serious signs, all these are given. And they should be examined by knowledge, by inference, the standard way you make a diagnosis. But the other column, there he says you must use your discretion. You must use the words of preceptors, people very experienced. You should listen to them. Use your discretion. Don't. So there is a certain liberality in the Ayurvedic approach. There is no intolerance to dissenting views. So here again you will find a place of prognostic signs, some of them called rishtas. In fact, a whole series of them, the signs of impending death. There are some 70 or 80 of them. Many of them don't look like signs of impending death to me, because I see so often, but they are all mentioned there. Then Charaka says at the end of it, you may interpret it according to your discretion. So that rishtas. Then medical procedures and formulations. If the illness is a mild type of illness, then it is shamana, simple treatment, that is fasting. Some medical formulations are given, rest, that will take care of most of the illnesses. But if there is a more severe type of illness, greater perturbation of doshas, especially excess of doshas, suppose a man is having a lot of productive sputum, that kind of illness, then you will need what is called shodhana, which means these perturbed doshas must be eliminated, procedures like panchakarma, etc. have to be done. That becomes a different, more serious type of illness. And shodhana procedures are mentioned here. Emesis, purgation, this is panchakarma, and these are always preceded by snehana, that is oily substances are given by mouth, and also body fermentation. These are done always as preliminaries. Then depending on, suppose the illness is the upper part of the body, then you will give emesis to get rid of these perturbed doshas, or it could be purgation, or it could be enemas. And Vagpata says, that I have quoted here, the whole principle of panchakarma, this emesis and purgation, if the body is within we have the alimentary canal in the center of the body, the gut and skin outside. In between this is the body, that compartment. Now, if there are millions of channels there, which I already mentioned, if these channels are blocked, how do you clear that? If it is blocking the alimentary canal, it is easy, you can give an emetic or a purgative and clear it. But in these canals, which are invisible, how do you clear them? So, it's a creative imagination. That is really how science begins, inductive reasoning, that they had. So here, if that problem, according to Vagpata, if you give these medicated oily substances or ghee, for example, in a certain way, then that gets in, because there are communications between the alimentary canal and the body. This is a porous bidirectional flow. So this gets into the body compartment. It permeates through all these channels. It loosens these thick condensations of doshas. And once they are, then you have this Turkish bath, the whole body is heated, and these oily substances which have loosened that, they all drift back into the koshta. And then if it is the upper part of the body, you give an emetic and get rid of it. If it is the lower part of the body, you can give enema or you can give purgative and get rid of it. So the toxic accumulations, you clear the system in this manner. That is how Panchakarma is used. And medicinal plants, very extensively used. Charaka has 1900, not of them have been identified. Animal and mineral products are used much less in Ayurveda compared to say Siddha system, for example. And the preparations, a multi-stage process, and they are ultimately formed into many different forms, 23 forms, pills or paste and so on, to suit different patients. And surgical procedures, extolled is given the first primary place in the branches of Ayurveda, and basic procedures are described into incision, excision, etc. And caustics and thermal cautery are also included in this, and common practice was removal of foreign bodies and many other procedures like removal of urinary stone and so on. And training, a fundamental duty of a senior teacher, you have to train the next generation. And there were two systems, one was the university system like the Takshashila or Nalanda, the other was the Gurukula system, which was much more national in character all over India. And the selection of students, selection of teachers, all these were extremely tight conditions. We will talk about it later. And the student had to have good liberal education before he came for admission. He had to major in a particular text which he had to choose himself. And the initiation, unlike in modern medicine where the patient takes an oath on graduation, here he had to take an oath on admission for medical training, which is a very elaborate oath covering all aspects of his life. And theoretical training and practical training, lasted on the average 6 years. Practical training in surgery especially, you will see experimental models being used to how to train a surgeon, how to do an incision, how to do an excision and so on. And special training in debate, if these are for distinction students who wanted to become the royal physician, who had a new doctrine to enunciate. For them they had to undergo a special training in debate. And both theoretical and practical training were given equal importance. Those trained in only one, Sushruta calls them, he is a one-winged bird. And surgical procedures, I have already mentioned that, how these experimental models, familiar models were used to train students in this, so that when he came to doing the same procedure in a patient, he was already confident, he had a trained hand. And systematization, which I have covered all the different aspects of Ayurveda, how all these fit into this pattern and how they have survived all these years and different regions, great many social and political upheavals all over India. The whole systems have been changed, but these procedures, the way they have been put together, that system has not changed. That is the importance of systematization. And the basic structure, therefore, if you compare doctrines, diseases and procedures from Charaka to Vagpata, 600 years, I made a comparison of this like treatment of tuberculosis, for example. The only change that you find is in the formulations that you are using, which would be different because even regions, since Vagpata was from Sindh, Charaka was from the north of India. So the formulations cannot be the same because medicinal plants would be different, resources would be different. So other than those, in terms of basic doctrines, in terms of basic procedures like Panchakarma, there is hardly any difference in spite of the passage of centuries. So one of the most important changes which happened during these years was the decline of surgery, which is a very serious subject. How in the first century or earlier, surgery which was extolled, venerated, given the first place, but by the 6th century it had lost its importance and its practitioners did not receive any respect. That is the major change which happened. Jivaka's training in Takshashila was 7 years.
7 years.
Yes. But 6 to 7 years. And the final, when the candidate was ready to practice medicine, that was left to the teacher. He had the last word.
He was the final word.
Yes. And once he decided he was qualified to be an independent practitioner, then he had to get a license from the king. That was not only, even after getting that license, if a doctor was going to do a major operation, for example, a dead fetus, or obstructed labor, very dangerous, risk is very high. If he was going to do something like that, he had to give a special permission from the king to do that. In fact, Kautilya's Arthashastra, if a person is running a hospital without a royal license, permission, very severe punishment was given. Similarly, doctors' fraudulent practice, even execution. It's a very major crime. So that, but the university system, like Nalanda, an invader would come and destroy. Same thing happened in Takshashila. Libraries are burned. So the whole thing ceases to exist. But Ayurveda survived because these Gurukulas, they could not be destroyed. Thousands of them all over India. That is how it survived.
That's one of the reasons also it's difficult to bring it out now because it's so spread out.
Yes, it's a disadvantage.
And so that's a disadvantage of bringing it out.
But in those days, especially the kind of like this training in debate and so on, somebody had a new idea, he had to present it before an assembly, all kinds of questioning. And if you read that section on debate, Charaka goes into such great detail, a hostile assembly. If you go there and they are all highly critical, how to face that, your adversary. And it goes into all kinds of politics. That adversary's weaknesses you should know ahead of time. Is he weak in history? Is he weak in speaking? All those, you should find out the weaknesses of your adversary and attack there. All that he says. So the debate was a very important aspect which continued in India all through even Shankaracharya's time or Buddha's time. That convincing a person and changing him. And Buddha did it very gently, very logically. In fact, in Buddha's dialogue, you will find once a Brahmin goes to invite him for a yajna in his house. And he tells him, it's a very big yajna, 100,000 animals will be sacrificed. So it's very big. So Buddha listens to him. Then he talks to him very gently. And finally, at the end of it, this man says, I don't want to do this. He changes him completely. So Shankaracharya's debates with the Buddhists. So like that, in medicine also the same thing happens. If somebody had a new kind of idea about a disease, about a treatment, he would have to establish that before an assembly, like a PhD thesis or something. A learned assembly, there you have to debate. So all these happened in those days.